I think this is the 8th week of our new reality, staying home and practicing physical distancing. Some provinces, as you've been hearing, planning for a slow reopening of the economy, although Ontario's planned no firm dates as yet. Now, while the country appears to be flattening the curve somewhat, there are still positive test results. Dr. Janet DeMille is Medical Officer of Health for the Thunder Bay District Health Unit. Dr. Janet DeMille, good morning.
Good morning, Lisa.
So I guess the big news over the last couple of days, now declaring an outbreak at Hogarth. Tell us what happened.
Yeah. So what we received was basically a positive result for an individual who works at Hogarth Riverview Manor, a long-term care facility, and works on a particular floor. This was actually part of, this individual actually happened to be tested because there's sort of broader testing happening with residents and staff of the long-term care facilities, and this one was picked up. Now, this individual developed symptoms at some point, and so would have likely been screened based on that anyway, but and that, so given that there was even just one individual, whether it's one resident or one staff person, according to our current guidance, we would declare an outbreak for that. And that is a lower threshold than we normally have for declaring an outbreak. It just recognizes the particular vulnerabilities of that sector, long-term care homes and retirement homes at this time as we navigate COVID. And we certainly have seen some very significant situations in other parts of the province or in other provinces, actually. And so that there's very strict guidelines about how to handle this so that we get on top of anything very early and put in appropriate management so that we can, we're monitoring it very closely. We're doing additional measures very quickly in collaboration, of course, with St. Joe's and the facility, right? I mean, we work with them on it, and so so it was interesting. We have been preparing for this. It always is. It gives you that heavy feeling though when you realize that there's somebody positive who's been in that facility and following up. The reassuring news, though, is that, very quickly the staff there were checking other residents. We were following up, and there's really nobody that has symptoms that could be COVID. And certainly we'll be monitoring that very closely. So really hoping with all the measures that have been put in place by the facility in advance of this, the work that was done over the weekend, that we don't have evidence at the present time that it's spread to anybody, right? And hopefully with the additional measures that were put in place and the additional monitoring that we'll do, that we will catch anything really early or, prevent that any spread from happening. So, yeah.
What'd you actually do there this weekend?
So, basically, we're connecting. It's the first thing is we immediately sort of connect with St. Joe's and get the information about this individual, what they were doing, where they were, who they were interacting with, confirming that the necessary approaches were in place, which we knew. So there was just a lot of information gathering. We did follow up with this individual separately as public health, like the way we would follow up on any individual who has COVID. So we're looking at kind of what they were doing, their symptoms, when their symptoms started, and the progression of that. And we, where, their home situation, who they're around, where they might have acquired the virus, for example, a lot of these questions that we're going to ask. And then following up several times with HRM, getting it and sharing that additional information to confirm that there was no additional people, for example, who had symptoms, and then followed up with them. And then the residents are very much restricted to their own rooms right now. They get their meals in their rooms. So some of the tighter enforcement, the practices on infection prevention and control, staff, working you want to kind of cohort the staff. You want to make sure that they're not moving into other parts of the building. Mm-hmm. But a lot of that was already addressed prior to this. And then we have a low threshold for any further testing, and I'm not sure at this point whether that was indicated. I have to get a follow-up from my team today, but so certainly just a lot of work. But it's very clear, though, that there's really a lot of measures already in place in advance of this that are, likely really reduce the risk of ongoing mm-hmm. transmission. And we just have to monitor it carefully and with St. Joe's to make sure that we're following up on any indication that there might have been transmission.
So that means this was part of the testing that the province ordered to say, I want when the Premier said, I want every worker, I want every patient, anybody who lives there tested. This is as a result of that.
So this is where it came out. Mm-hmm. However, that's how it came out. However, this individual developed symptoms, and I know that, at some point, that's the other way this individual may have been. It may have come out that way as well, because mm-hmm. once the person had symptoms and were screened, they would have been immediately sent for testing as well, because we know that that's happening in long-term care workers, as well as any healthcare worker is priority for that kind of testing. So they would have been, had they screened positive, because they do screen their staff every day, and had that person sort of had symptoms, they would have been sent for testing. So, it's nice to know that there are sort of checks and balances in place to be able to make sure that we're really minimizing the risk of COVID being in that facility and potentially transmitting.
Mm-hmm, mm-hmm. Now, I know you got the results back from your first weekend of drive-through testing, and that was clear. What about the second weekend? Anything back from that yet?
So yes, I think we did 205 tests on the second weekend. We did have one positive individual for whom we have no known exposure on that second weekend. So there's no close connection with somebody else who had COVID, for example. So that does suggest an indication of community spread. And actually, of that second weekend, 205 tests, I think we're still waiting on the results of 40, which I find is another concern about why it's been so long and we haven't had those results. But the overall picture. The overall picture of the community surveillance work that we did over the last 2 weekends paints a good picture for us that we have just a very low level of community spread, as indicated by that one individual that didn't have any other exposures. Mm-hmm. And so that's consistent with what we had been thinking, so it's nice to get that confirmatory evidence. I will note, actually, Lisa, because I think maybe there was one, I should note that first weekend there was actually one individual who did test positive, but they weren't part of that community surveillance. So this other individual did have an exposure that we were aware of, and we invited that person to be tested. And they did turn out positive, which didn't surprise us. So I think maybe our communication, we had nobody positive in that community surveillance piece, but we did in fact have one person positive who we had separately invited to be tested at that time because they needed testing. So a little bit of a communication issue that may be mm-hmm. on that.
So overall, the city is still doing remarkably well.
I would have to say we have done really well. We have held this virus at bay, even though it's here. It's clearly mm-hmm. here, right? And we do have individuals who we have followed. I think we're up to 74 right now, and that's the broader Thunder Bay District Health Unit area. So, but I think we've done well, and whether it's, excuse me, whether it's just the number of people we've had in hospital. That's one indicator. The number of deaths, which is only one at the present time, which is, sad but reassuring in some ways. And certainly our testing in terms of when we follow up on people and we try to identify, where did this person get the virus? those numbers have actually been fairly low in terms of people that are that likely got it somewhere in the community where we can't pinpoint exactly where. So it's very reassuring. You did talk about, though, the province reopening, and certainly we're hearing more about that. And in fact, there was some news release on Friday about some seasonal businesses maybe beginning to reopen or prepare for reopening. And I have to say, I have a sense of nervousness about the whole reopening. I appreciate that we are able to do it, and we have to do it very cautiously, though, because everything that we've held back with these very significant measures that we've had in place for the last month or month and a half, basically, as we start backing off on it, we could very easily see broader community spread, and therefore that burden on the healthcare system can come back, or the long-term care, there's more vulnerabilities, and we very much need the appropriate things in place to be able to effectively monitor that level of community spread and to watch it carefully. We need to make sure that healthcare facilities and long-term care homes and others are prepared, that they have the resources they need to be able to manage an increase or to be able to prevent the spread, right? We have to, and I'm sort of nervous. We need to be, maintaining that physical distancing. We can, look at reopening and doing things, but we cannot let go of all of those different measures that we're all taking, right?
Absolutely.
And that physical distancing. And if we start to gather together a little bit more, if we start to get a little bit more relaxed, even for ourselves on this, then it could end up that we'll have more community spread and get into a little bit of a problem, really.
I can understand everybody in public health being a little nervous.
Yeah, and you know what? We just haven't done this before, right?
Yeah.
Not to this degree, and I was reading some stuff over the weekend where they call it the hammer and the dance, right? The hammer is when everything comes down and everything closes, and it's a very strong kind of approach, right? And that's what has worked for us, as well as what every individual is doing, and everybody has been. I'm impressed really with what the things that I'm seeing, right? But now we're kind of able to back off, but it's like a little dance. We still have to maintain a lot of that still in place, and we have to be vigilant, and we have to be careful, while at the same time sort of allowing things that that can help us, right? Allowing things to open, and when I look at the summer weather and the things that we normally do that can really help us with our own, even emotional and mental well-being, right? Which I think is really important. But we have to do that with it. We have to see it as a bit of a new normal. We can't do things even the way we've always done them in the past, right? We still have to be very mindful of that physical distancing, staying home, staying away from others when we have any symptoms, even mild symptoms, right? Because and get tested. So we have to maintain that vigilance.
Thank you so much for joining us this morning, as always.
No problem, Lisa. No problem.
Take care.
My pleasure. Okay,
Bye-bye.
Thank you. Bye-bye.
Dr. Janet DeMille is Thunder Bay District Health Unit Medical Officer of Health.